Prior to gastric bypass and sleeve gastrectomy, we always perform an EGD or an endoscopy. And this is an outpatient procedure. It's a very quick and simple procedure, but a really necessary one. Regarding the sleeve gastrectomy, we're going to be removing a large portion of the stomach, and we need to make sure that the stomach that is there, that's being left behind, doesn't have any irritation that needs to be treated before surgery. And also we're looking for things like polyps in the stomach, or perhaps a mass or a tumor in the stomach that would cause us not to do the sleeve gastrectomy. It's a completely different procedure to remove a portion of the stomach if you have cancer versus doing a sleeve gastrectomy. And then probably one of the most important reasons we're looking for sleeve gastrectomy and for gastric bypass is we're looking to see if a patient has what's called a hiatal hernia. When you're overweight, you have a lot of pressure pushing up on the diaphragm from the stomach area, and that can open the opening in the diaphragm. So there's a triangular shaped opening that the esophagus passes through so that your food can go from your mouth to your stomach. And if that opening gets bigger by pressure pushing backwards from the stomach area, that area can open up, and now your stomach can actually go up into your chest and back down into the stomach area. And when you get that phenomenon, you get a lot of heartburn or a chronic cough. And if we have this hiatal hernia, we need to be able to recognize it because it needs to be repaired during the time of your sleeve gastrectomy. And for gastric bypass, it's important that we do an endoscopy before your surgery because we are cutting the stomach crossways after we put you to sleep for your gastric bypass. And so once we divide that upper part of the stomach from the lower part of the stomach, we can never look back inside the stomach again. So we don't want to miss something that's down there like a tumor or something else like some inflammation that we could identify prior to your surgery, or a polyp that could be removed. So we want to take a look down inside of that stomach prior to your gastric bypass to make sure everything looks okay before we actually disconnect it and never to be able to look at it again. So it's really, really important that we have the endoscopy done prior to both of these procedures.